How when we look at this and think about for our patients, for endovascular arch repair, I think TAVR is a good example of this. EVAR is a good example of this. TEVAR is a good example of this, right? Which is all of this brought together. But a lot of the endovascular work that's been done over the years, there was initially skepticism of, is it going to be as durable as we want? Does it really apply to the number of patients that we want? Can it be expanded to groups outside of the centers that are involved in clinical trials? And I think all of us that have been involved in the clinical trial and the experience outside the US now, I think demonstrates this well. This device can be used by all different types of practitioners. It can be safely used. It has long-term outcomes now outside of the US that we see that are really promising. And I think when you look at this technology, although there's always going to be the skepticism and people say, look, an open operation is still the best for the aortic arch, many patients just can't have that. And I think we're seeing now stroke rates and complications from the procedure that are really looking very similar to open surgical approaches. And thus why I think we're going to see this become an everyday part of our treatment paradigm, is to say to patients, we look at open, we look at endovascular aortic arch. Most patients would prefer a less invasive approach. We can offer this to you.